We're live.
All right. Good morning, everyone. It is February 26th, and this is the Senate Health and Welfare Committee. We are meeting today with a couple of our ledge councils to try to finish up bills that we've been working very hard on. So the first bill this morning is S48. And Amarin, before we ask for your input on anything that's new and different in the bill or how it stands, I want to turn to Nolan Langwheel, because I know you have a schedule this morning, don't you, Nolan? Would it help for you to just go first?
Sure. I didn't realize I was going to testify, but I'm happy to.
I think just briefly on the fiscal note that you have provided. It doesn't
Sure.
need to be long because we've already seen one fiscal note. Maybe comment on the things that are different. We can pull it up on our iPads or
Sure.
in our other
I-
screen.
I can pull it up real quick too.
Okay.
All right. Do you see that?
Yes, we can.
Okay. For the record, Nolan Langwell, the Joint Fiscal Office. So based on the conversation we had earlier in the week and some information that came to light about timing issues, about the cycle of 2-year licenses and when those happen, I revised the estimate. And so in short, based on that timing, the estimates are still 900 to a million, but it's spaced out over time. So in fiscal year 22, there'd be no impact because the first cycle isn't going to be renewed till 23. And most of those, and the RNs and the LPNs are on different year cycles, and more of them are RNs and LPNs. So in 23, the LPNs would renew, but there's a lot, the RNs would renew first in 23. So it'd be a bigger impact in 23 and then a smaller impact in 24 when the LPNs renew. So in short, there wouldn't be a 22 impact, and then the rest of it we spaced out between 23 and 24.
And so, and the assumption that you're making regarding the number of RNs, for example, who are going to compact license, are you considering 100%, 45%, 60%?
I based this off of a combination of the Secretary of State's report,
Okay.
and then conversations I had with them. So it's based off of assumption that all Vermont nurses and LPNs would obviously get a compact license. It's based more on the loss of revenue from those who would normally be buying a Vermont license in addition to the other licenses.
Got it.
So the other two things I would just say are that these fees are used, as I said last time, they're used to help fund the Board of Nursing and that work through OPR, and that they have said that they would deal with the reductions by offsetting, by trying to find administrative efficiencies and increase licensing fees. So, and because the fact that I believe, and I can't speak for them, but they're very supportive of this, I would say that I imagine that they will just build this into their 23 or 24 budgets when they do those, which we're not doing this year. We're doing the 22 budget. So,
right.
So that's something I would sort of flag. And then finally, I would just say that there is an annual fee of $6,000, which is very minimal, and it can be also captured within their existing budgets.
Okay. Thank you. Questions committee for Nolan. Senator Hooker.
Thank you. What is the fee for the compact license?
$6,000.
Okay, so that's
the whole
fee
state.
for the whole state. So the nurses don't pay anything else?
They just pay their licensing fee. And then we just pay $6,000 a year to be part of the compact.
Okay. And what do the nurses pay?
I don't remember what those numbers are. I believe that
we've got that somewhere in our notes. We'll
yeah.
have to check.
Yeah, Lauren testified on that the other
Yeah.
day, and she talked about what people are paying now and what they would pay. And
$190, I think, was what
Yeah.
she said for the fee for the nurses. So that fee would stay in place, but then
if they're buying a Vermont state license, then they would pay that fee.
And they're automatically in the compact by paying
No.
that fee?
No. Amran, do you want to clarify?
For the record, Ameren Aberdaily Legislative Council, there are two options. A nurse can either get a Vermont state-only license or the multi-state license. And my understanding is that the multi-state license does require the background check. So I believe the
so
OPR director that there would be an additional fee because of the background
$30
check.
for the fingerprinting or whatever. Okay. All right. I was just curious to know what the cost was going to be for nurses for the compact license and, as part of the Vermont state license as well.
And
Thanks.
part of it also depends on like, if you're a nurse that has multiple state licenses versus a nurse that only has one state license, that'll impact what you pay compared to what you're paying now.
Okay.
Okay, Senator Hooker? Good. All right. Any other questions? Thank you, Nolan. And that's great. Answered a lot of good questions. Okay, so Amran, why don't we move to S48 with the committee? And it's my understanding that, now get back to where I was. We're still on the bill as introduced. Have we made any changes at all?
We have not.
Okay. And we did talk about some qualifying language regarding the expenditure of funds or bonding. And we received a note back from Steve Klein, who said that rather than put this onto joint fiscal, if there's any bonding or other expenditure required by the compact, that it go through the appropriations process. Senator Cummings, is that your understanding as well? And you're muted. You're our finance expert, so I've got to turn to you.
No one else seems concerned. So I'm going to let the governor,
Yep.
run herd over his administration. I flagged it, but no one else picked up the poll.
All right. Senator Hardy.
I thought we had talked about putting language in the bill. I'm surprised to hear, and I didn't get the email that Steve sent. So I'm feeling out of the loop here because I had the same concerns. I thought we had talked to Ameren about putting language in the bill.
So I talked to Steve, and then I had forwarded, or I had sent Steve an email. He responded, and I forwarded it to Senator Cummings and Senator Lyons. I apologize, I didn't send it to everybody else.
Yeah, so Nellie, we'll get that email out and have it posted. No, Nolan, if you have.
Or I can just explain it. I mean,
What's the
Go
gist?
ahead. Go
the
ahead.
gist is basically one that we felt that he felt that it should just go through the normal budget process, just like everything. There's a lot of things like NCSL and other organizations that we're part of that they increase their prices. And, we just decide whether we want to continue to be a part of it or not. I recognize there's that concern that the compact, they would increase the price but that would be after the fact. And my understanding is, according to Lauren, we'd still be on the hook based on our agreements with them, regardless of joint fiscal or not. And the other concern that Steve had, which is around joint fiscal, is there's an idea that we set a precedent by having everything go through joint fiscal all the time. Every contract that we negotiate or everything that happens, there's a sense that he didn't want to create a precedent that more and more things would go through joint fiscal. So those are some of the concerns.
Go ahead.
But I
Senator
thought we weren't talking about the $6,000 fee. Like that's
Hardy.
minimum.
No,
We were
no,
talking
and it wasn't. Yeah, and it wasn't the annual fee.
right.
It
No,
was, and I
totally
will
different than
double check
this
with
year.
Ameren. It was the compact board has the power to enter into debt. And that even if Vermont leaves, we are liable for the debt that we committed to while we were part of the compact. And there is no checks and balances on the amount of that debt. And
And the
You know,
idea,
maybe what we say is before voting to approve any debt, the representative notify the Office of Budget and Management.
the concern that I completely understand your concern. I talked to Lauren about this, and her concern was that we'd be like a Vermont's representative would be like one of 36 people on that board, and they would vote on it. And even if we as Vermont said we don't agree with it and they vote on it, we are liable. And there's no process that we can put in Vermont statute once we signed this compact that would change our liability. So I understand your concern, but I think, and I would probably defer to Lauren on this, that by joining the compact, we are essentially agreeing to that up front. That said, my understanding too is that that kind of thing is not likely to happen, given that.
Yeah, we heard testimony from folks that extraordinary debt was not likely to happen. So some of this is going to have to be on based on trust and what has occurred with the compact so far with the other 34 states. Oh, Senator Hardy, then Senator Hooker.
So I agree that it's extremely unlikely that they're going to incur really high debt. I doubt that it's going to happen. However, we did get testimony from the person at the compact themselves saying that it's appropriate for us, or possible for us, to put language in the section of the bill that's specific to Vermont's actions that would say that there needs to be some approval at the Vermont level for incurring debt. We could have our own internal process, and that's when the JFO thing came up, and that would be fine. And then there would be some kind of process for the person who is our representative on the board to get permission from the powers that be here, whether it's joint fiscal or whomever we decide, then before taking a vote on the debt. And that if we say, joint fiscal or whomever says, no, we don't want to incur the debt, then we would have it on the record, and then we could take action to, that it's just a sort of, belts and suspenders or whatever.
So this is exactly why Nolan reached out to Steve Klein to ask that question. Would it be appropriate? Would joint fiscal be the place to put that responsibility? And
you could also make the governor or the.
Yeah, we could
management.
make it the appropriations process. So right now it continues to be what is proposed in the budget and whether or not it's approved in the budget. And that would require conversation, not just with our committee, but other committees that are involved in with the compact. Senator Hooker had a question, but Senator Cummings, you want to contribute?
I think if we say debt over 100,000, our representative will notify the Office of Budget and Management, just so that we aren't taken by surprise and we have the opportunity to say we're gone before we assume $1 million or $10 million worth of debt. Belts and suspenders.
How would that sound to folks? I think that's a great suggestion, and it certainly responds to the concerns that we've expressed in committee. Does anybody not like that?
I think it makes sense. Thanks, Anne.
Okay, Cheryl?
Recommend you go to you might have it go to the Secretary of Finance. or
Yes.
the Commissioner of Finance.
That's right.
Yeah. So
My questions were around that, and they've been articulated. My final question is, our only option then is to withdraw from the compact if we don't like it. Okay.
yep, that's about it. 'Cause we only have one vote out of a whole passel of people.
Yeah, and if we don't want to get into that kind of debt, we pull out and we're not responsible.
Right. So we've done this before with other compacts. I can remember, I think the limit on one that came out of economic development was $20,000. If we spend more than that, then it goes, I forget where it went, but I know that that was something we did about 8 years ago. So having, Anne, you're suggesting $100,000. What, I
Pick a
mean,
number, but yeah. Just so somebody in state government is aware
Yeah.
of what is going on
Yeah.
before we find out. I doubt that, other states are no more liberal with their money than we are. I doubt that it would come to that, but I think it's good to just know what's going on.
okay, so Amron, can you craft a sentence for us, and where would it go? Would it go at the end, as you said the other day, or?
Section.
It would go into the last section of the bill that is outside of the effective date section. And let me make sure that I have this right. This would be if the commission were to incur more than $100,000 of debt, the
It was
administrator for the state
Propose,
or propose.
Or something along
compact
the lines of,
proposes.
yeah, liability to the state of more than 100,000.
right,
Or 100,000.
Yeah, that's right.
Charge us 5, we probably wouldn't
Yeah,
care.
we're 1/34 of that.
right,
Okay, proposes liability to the state of over $100,000. The state, the Vermont's administrator would notify the Secretary of Finance and Management.
Prior to voting.
prior to the, right, the representative voting. So it would be $100,000 or more.
That just removes the sense that there's one person making the decision. So
It's a comfort level, as Senator Hardy said, it's belts and suspenders, but it does make us feel better about it. And it's a good thing.
And to your point before, Senator Hooker, even if that happens, it doesn't necessarily reduce our liability. But as Senator Hardy mentioned, it might give us some legal avenues to object to it.
Okay. Is there anything else in the bill that the committee would like to look at? Okay, Nolan, thanks for the communication with JFO and bringing us that information. And I'm glad that I hope, resolved that. Amron, is it possible for you to show us that language within the bill at this point or not? Can you do that
At the
online?
moment,
Okay,
not at the moment. I think what I will do is do an amendment that replaces that last Vermont specific section so you can see it in context, rather than doing a strike all of the whole bill.
that's a good idea.
Okay, so I will work on that. And are you looking to have this back in committee this morning?
Well, I was hoping that we could vote the bill out today because, after a while, it gets redundant. So how much time do you need? How long give me a time that you can come back and we'll, I was thinking before the end of our committee meeting. We end today just before 11:30. If you can come back in at 10 after, even at 11, that would be good.
Yes, that should be possible. I'll have to get it through editing first, but
Yeah,
I think they can probably do that.
Okay, so it'll just be that one paragraph.
Yes.
Okay, because I don't think there are questions on the rest of the bill, and I think the committee's been through it sufficiently. Some of us have been through it more than sufficiently.
Mhm.
Okay,
All right.
all right. And I have not heard back yet from Senator White. I will touch base with her again to make sure or see what the GovOps committee has done or has not done, or what their position is. I suspect that because it's the committee is pretty much the same as it was, they may not need to have Ameren in, but I don't know that. I can't speak for them. Okay, thank you. So Nellie, is there anything else for Ameren at this point? We're good. So we're going to move on. As soon as Jen gets here, we're going to go through the flexibility bill. And so before she gets here, I thought it might be helpful just to hear some thoughts from folks about what you all heard yesterday. Jen is going to be bringing in perhaps some language. Okay. Are you interested in discussing the flexibility at this point, or Bill at this point, or would you like to wait for Jen? It's open to you. Senator Cummings.
Is it possible to make any changes of that bill, or are you set on sending it out as is?
Which part of the bill?
I think we all expressed some concern about the audio only section and the potential cost to the potential impact on rates, and thus the affordability of healthcare for people.
So, yeah, and I think your suggestion yesterday of adding in the effect on rates to the data collection piece and the review piece is very
That's not going to help the people who find their health insurance rates go up 8%, and you're not going to get data from them if they can't afford their health insurance. I mean, I know how painful it was when that association ability went away and all these small employers found that they had to either cut back on coverage or cut out coverage. We don't know yet the cost of all the things we've asked insurance to cover during COVID, all the co-pays that didn't get paid, all the cost of COVID care. We don't know that. And we can collect the data and simply let the insurance companies negotiate what they'll pay for certain of those new categories. And that protects everyone.
So we did hear, so I think what we'll do, we did hear that the insurance companies suggested a 2% rate increase as a result of this 1 year data collection process on audio only. That's what we heard. And that, but we have invited Sebastian Darduengo of DFR in, and he will be here at 10 o'clock. Jen will be here at 9:30. There were some suggestions that we made for changes to the bill. We'll go through that with Jen. Then we'll hear from DFR and see what their thinking is. In particular, we asked them to look at the timeline as a way of shortening the data collection period that might reduce some of the concerns that you have around rates. So my thinking is this, that let us take a break until 9:30. I hear you, Senator, loud and clear, and that's one of the reasons we continue on with this bill. But I do know that there are a number of people out there who I think, and I agree, audio only is part of the future of medical care. There's no question about it. But not knowing how to put it into the financial or fiscal world is the tough part, and we get that. So let's take 5 minutes. Unless someone else has something else to say. Okay, let's take 5 minutes and then when Jen gets here, we'll go through the bill. So Nellie, we're going to go on a short break, 5-minute break.